So I am going to talk you through how to practice your connection breath, and this is something you should definitely be practicing all throughout your pregnancy and into your fourth trimester or post-delivery. When you are postpartum, that will really be the first step into rehabbing your core, especially if you have had diastasis recti, where your abs separate a little bit. Even if you didn't have a severe case of that, I would still do these connective breaths before you start any core work or any type of workout. So you can do this in a couple positions: standing, sitting, laying on your back, or laying on your side. I'm going to show you laying on your back here. So you're going to lay on your back and just place those feet on the ground nice and light. I like to put my hands right over top of my rib cage so I can feel it expanding and compressing. When we do this breath, we want to think that there is a nice big cylinder in our torso here. First, we want to fill it up with air, and then we want to compress it. So as we inhale, we let those rib cages expand, we let everything loosen, and then as we exhale, we want to think about knitting our ribs together or your fingers together, and then pulling your pelvic floor up and in. So let's work on that connection. Nice big inhale. And exhale, compress everything. So you want to work on this a few times a day if you can. Big inhale. So make sure you are feeling that pelvic floor as well. You want to connect that to your breath. That is just going to help rehab your pelvic floor as well. So when you do this breath, you might find a small pelvic tilt as you exhale, which is fine, but we don't need to totally flatten the spine to the ground. We want to keep a nice neutral alignment the whole time. And then we will use this breath as we progress into any type of core rehab exercises that involve picking our legs up off the ground. We don't want an excessive arch, and we don't need to totally flatten into the ground. So think about keeping a nice neutral spine the whole time you are doing your connective breaths.